because of this trauma that's happening from the spike protein and also this cytokine storm that is occurring, we're seeing more thyroiditis coming from COVID-19. We're also seeing this likely in response to the COVID-19 vaccination. So it's not just COVID-19, there's the vaccination that's involved in that. I'm Dr. Jake. I'm a naturopathic medical doctor and integrated physician. And on this channel, I share with you how you can heal your body down to the root causes without any harmful drugs or surgeries. Be sure to subscribe for more videos like this one. Okay, let's jump in. So what have I been seeing in the past 4 years since the COVID-19 pandemic has occurred regarding the thyroid? What I have seen is my patients that are coming in with long haul COVID, almost all of them have a thyroid that is under functioning, or a lot of them have Hashimoto's thyroiditis, which is an autoimmune condition of the thyroid, or they're having conversion issues of the T4, T3, or they're just frankly not producing enough T4 production. So a lot of thyroid stuff going on. There's a lot of hormonal dysregulations that occurs with patients that have long haul COVID. So COVID-19 is definitely having an effect on how the thyroid is functioning in people. What is the research showing with the connection between people that have been exposed to COVID-19 and thyroid issues? So what we are seeing in acute COVID, and we're talking about acute and chronic long haul COVID, what we're seeing in acute is when people currently, they have the virus, is the spike protein goes and binds to these receptors called ACE2. And that's what is all the damage that is happening from COVID-19 is the spike protein attaching to these ACE2 receptors. And we have a lot of ACE2 receptors in the thyroid gland, also in the hypothalamus and the pituitary. We even have a lot more than that in the lungs. So we think about COVID-19 as a big lung disorder, but actually we have a lot more ACE2 receptors in these endocrine organs that I just talked to you about. So it's even causing more trauma to these organs than even in the lungs, based on how many receptors are actually in these tissues. So let's go back a little bit. Like I talked about the hypothalamus and the pituitary. Why does that matter? Is that's parts of our brain that actually send signals to our thyroid. So you go from the hypothalamus, sends a signal to the pituitary, and the pituitary sends a signal to the thyroid gland. We call it hypothalamic pituitary thyroid complex. Okay. So if you dysregulate anything on that line, the hypothalamus, pituitary, and thyroid, all of it's going to lead to thyroid symptoms. You damage the hypothalamus, you're not going to get the right signal to the pituitary. You damage the pituitary, you're not going to get the right signal to the thyroid. And if you just damage the thyroid itself, it's not going to actually work in response to the signal that it's receiving from the pituitary gland. So it's causing trauma to these organs. This is happening long term. So we're seeing the short term is causing dysregulation. We're seeing that hypothyroidism is happening when people have the current virus, either for 2 weeks to 2 months. But we're also seeing this long term that people's thyroids aren't working as well, or there's a dysregulation of how the brain is working with the thyroid after getting exposed to COVID-19, which makes a lot of sense. You have a lot of these ACE receptors, ACE2 receptors on these organs. The spike protein is released, it causes damage to these organs, and the organs don't heal after the damage has occurred. Also, what happens with COVID-19 is there's this big cytokine storm. That was what was a big issue with COVID-19 is making your immune system get way overstimulated, causing way too much inflammation. And that's what was leading to the lungs spasming and people were passing away because of the cytokine storm. So a lot of therapies were being developed to stop that cytokine storm. But what happens with the cytokine storm is it also causes dysregulation of the thyroid. It causes these cytokines that are produced in the cytokine storm, dysregulates how the signals are received and also how the thyroid works. And also, if you mess with how the thyroid works, this is going to mess with how the thyroid attaches to and sends signals to our white blood cells in our immune system and be able to do cellular immunity, natural killer cells produce, Treg cells, all these type of things get dysregulated. So we're not able to fight off the infection more regularly. And this is happening long term too, is the immune system's just not working very well. So people are getting long haul COVID and also not able to fight off other infections they get exposed to or chronic infections that they're in, they have are reactivating because of this regulation of the immune systems that's happening from the cytokine storm that happens when you get COVID-19. Does COVID-19 cause inflammation of the brain? Absolutely yes. And that's a big problem with COVID-19 and people having these long haul symptoms is the inflammation of the brain. Because we talked about how it's damaging the hypothalamus pituitary. These are pieces of the brain that send signals to our thyroid, but also to all other organs throughout our body. It's not just the thyroid, to our adrenal glands, to our secretory organs, to our ovaries, to our testes, etc. So all hormones are becoming dysregulated, but that's that piece. But also it's affecting the frontal lobe, parietal lobe, occipital lobe, etc., and also our cranial nerves. So that's why people are losing their ability to smell and taste and etc. And also giving people tinnitus. And that was that inflammation of the brain that is happening. Also, we're seeing dysregulation of neurotransmitters that are happening because inflammation of the brain and leading to depression, anxiety, insomnia, etc. So that is opening up a huge can of worms when we're talking about inflammation of the brain, but COVID-19 absolutely does that, do that, not just short term, but it can be an issue long term if people aren't taking care of the virus appropriately when you have it acutely. Is there increased incidence of autoimmune thyroid disorders because of COVID-19? And yes, based on the research that we are seeing, is because of this trauma that's happening from the spike protein and also this cytokine storm that is occurring, we're seeing more thyroiditis. So Hashimoto's thyroiditis or also Graves' disease. So hypothyroidism or hyperthyroidism that is coming from COVID-19. And we're also seeing this likely in response to the COVID-19 vaccination. So it's not just COVID-19, there's the vaccination that's involved in that. Remember, we talked about this a little bit a long time ago about how the vaccine works is what it does is turns your body into this factory to make this spike protein. And then that makes your make antibodies in response to that to try to kill off the virus. But the spike protein is what's actually damaging the thyroid gland, like we just talked about, right? So the vaccine is also leading to more incidence of these autoimmune conditions in the thyroid gland. What are doctors doing to actually treat the thyroid that has been damaged by COVID-19? The basic doctor, what they're doing is they're seeing that your thyroid is not making enough thyroid hormone. Let's say you have an elevated TSH, like, okay, you need thyroid hormone. And they're going to give you Synthroid, which is T4. So if you go to a doctor like me, we're going to dive into it a little bit more detail. We're going to care and check actually to see, do you have an autoimmune thyroid issue going on? And we're going to approach that autoimmunity. We're also going to see how long has this been going on? How much damage has happened to the thyroid? Are you going to actually have to take thyroid hormone? In many instances, we have to take thyroid hormone for a little bit, but to be able to heal, then we heal up the thyroid gland. And then over time, you're not going to have to take thyroid hormone again. Usually when we do this, it depends on how much trauma has happened, but we're going to prescribe it in several different ways. It's not just going to be Synthroid. Maybe Synthroid would be the right option for you because you're converting your T4 to T3 effectively, but you might have a conversion issue going on and you don't convert your T4 to T3, and maybe you actually do better with just T3, or you need a combination of T4 or T3. We might give you a glandular, but if you have an autoimmune thyroid issue going on, you don't want to take a glandular because it's likely going to make the autoimmunity worse. We're going to work on decreasing this inflammation on the brain. So your hypothalamus and pituitary is going to work effectively. So you're going to do some anti-inflammatory agents that will help do that. You're also going to work on looking at all these other reactivation of other bugs that have occurred that is continuing to cause this inflammatory response, is continuing to cause this autoimmunity of the thyroid and also inflammation of the brain. So you need to put those back into remission. So that's just a quick overview of how a doctor like me, an integrative doctor that is knowledgeable about how to approach long haul COVID, not about like just a conventional doc, not really understanding what's going on at the big level with COVID-19 and just being like, okay, TSH is elevated. We just need to give you T4, but they're just giving you the T4, but there's all these other things dysregulated and you're going to have to depend on T4 the rest of your life if you approach it that way. Yeah. If you want to find out what the root cause of your illness is, give my receptionist a call by visiting www.integrativemedica.com. Find our phone number there, call my receptionist, and she can set up an appointment with you guys. Also, you can set up an appointment directly from our website. If you want to learn more about COVID-19 and thyroid health, click my videos to the right. I'm Dr. Jake, and I'll see you there.